Welcome to another SaltBaked Q&A Green Scene. Today we are with cannabis researcher and a woman with more than 20 years of professional pharmacy experience, Mindy Madeo, who is also pharmacist in charge at WholesomeCo Cannabis dispensary in Bountiful, Utah. And she's also a graduate student at the University of Maryland Pharmacy School, pursuing a master's degree in cannabis science and therapeutics. Welcome, Mindy.
My name is Mindy Madeo, and I have been a pharmacist for 20 plus years. I went to the University of Utah. I grew up in Brigham City, went to the University of Utah. After college, I moved away and worked in St. Louis and Denver. I was gone from Utah for about 7 years. And I worked in a variety of retail pharmacies, like Walgreens, Target, CVS. And I just loved my job. But I was always kind of like the more natural pharmacist. Like I would really recommend that people come off of their medications or try non-prescription alternatives or herbal medications. So I did retire 3 years ago completely.
Congratulations.
Yeah. Well, I went back to work. So I'm not retired anymore. So I did retire for 3 years thinking I was done with pharmacy. And I was just kind of frustrated with medical, the whole entire healthcare system, insurance, the way we're treating patients. I felt patients were over-medicated, over-diagnosed. And so yeah, I did quit for about 3 years. And then out of the blue, Proposition 2 happened. I had no idea like this was happening. And I had no idea also that I would be so interested in cannabis medicine. As soon as I heard about the law passing, gears started turning in my head, and I was just so excited to be able to use this to help people get off more, especially their opioids. I had a couple patients in my career that were on really high numbers and milligram of opioid medications, and they would come in, and you can tell that they had a very poor quality of life. And I watched these two patients just improve so much. I didn't see them so much. They weren't filling the prescriptions. And then they told me after.
Could you break that down for us a little bit? Why that looks so poor? Their quality of life.
Yeah. So just when you're on opioids, especially for real severe pain, there's something called this tolerance you get, and there's really no dose ceiling with the opioid tolerance. So you'll start at like a 5 milligram. That'll very quickly not be enough. Then you go up and up and up and up. And you do get to a point, it seems like, with the opioids where it's not treating your pain. There's even a syndrome where when you're on a really high doses, it actually makes your pain worse. So, and kind of I'm sure you've heard about the opioid epidemic. It was around 2008. When doctors were just being very liberal with their prescribing of OxyContin, which is an extended release opioid. And it was just a mess, especially in Utah. The doctors have gotten better, but opioids are a good medication sometimes for people, but you can get carried away, and really your quality, it's almost like you're in a fog. It's almost like and you don't have that good pain control. Some people do well on them where their pain is being addressed and they are not getting that increased the tolerance. But many of the patients I saw were not happy. And yeah, so I saw these two separate patients get off everything, and they both told me after the fact, they alluded to the fact that they were using cannabis. They're going across the border to Colorado, and I kind of just always remembered that. And then as soon as I started doing research, there's some really good research out there that cannabis plus opioids actually has a synergistic effect. So if you take cannabis along with your opioids, you can very easily cut your dose down, not to mention the fact that cannabis treats all the symptoms of opioid withdrawal. So in my head, as soon as I heard this, I had all these visions of like, oh, maybe we can go on rehab clinics and get people off their medications via cannabis. And that was kind of my motivation. Like, that was the reason I jumped back into this. And so I met the Wholesome group probably about a year and a half ago. And I really liked them. I liked the fact that they were local. They had really similar ideas as mine. And I've kind of been with them throughout the process. And we just opened a couple months ago and it's going well. And the job's even better than I imagined. I'm really having a lot of fun counseling patients every day.
That's superb. First
Yeah.
follow-up question I'd like to ask is, could you just very briefly explain the chemistry or how cannabinoids work to resolve pain and how that's different from how opioids manage pain?
Sure. So first of all, when you're talking about pain, you've got to realize that it's usually not just pain. There's a lot of comorbid conditions like anxiety, sleeping problems that almost always go along with pain. And so those are very easily treated with cannabis as well. So you're not just treating the pain aspect, you're treating a lot more things than that. So in a cannabis plant, there's 400 or 500 chemicals, so many we can't even begin to understand what a lot of them do. And in my consultations, I have this poster that I show, and it has some of the different cannabinoids that have medicinal effects. We know THC, Delta 9, the THC that everybody knows and everybody loves. That actually is a really good pain reliever. It's really good for sleep. It's really good for anxiety. So it does treat pain. There's been many studies that have shown this. And so kind of the key I like to talk to people about too is we want what's called microdosing, where you're getting this THC at a level that's treating your pain, but you're not necessarily being impaired. You're not don't have a lot of the psychoactive effects all day. So these people, I don't want them to feel like they're on the THC. I want that THC just to work at a very small level, so they can't even tell it's there.
All right. May I ask, I'm curious, there have been studies about how the psychoactive elements in THC perform with people who suffer from anxiety. My instinct had always been, well, cannabis might be a great way to approach relief from anxiety. Why or why not?
Yeah, so cannabis does hit, especially so is one of the components of cannabis that really helps with anxiety is CBD, and we've heard a lot about CBD. A lot of people pull out that particular cannabinoid and they sell it all over the place. But you really, for CBD to be effective, you also need a THC. So it is very effective for anxiety. And one thing I wanted to mention too, when it comes to anxiety, which I kind of didn't realize until I started working, there's a lot of people that use like Adderall for ADHD, for example. And when I started this job, I thought I would be helping a lot of people come off of their pain medications, their sleep medications, and their anxiety medications. I did not realize how many people can come off of things like mood stabilizers, antidepressants, and especially Adderall. And to me, it didn't make sense. I mean, because really Adderall is an upper and cannabis is a downer. So just it seems like you wouldn't really replace one with the other. But a lot of times with ADHD and not being able to focus, anxiety is tied into that. So with a lot of these patients that are on Adderall, we're actually able to treat the anxiety. And that was really the problem, rather than them having this ADHD disorder, not allowing them to focus. It was the anxiety. So I just want you to let you know that anxiety is kind of hidden in different ways. It's not always what we think it is. And I do think cannabis, just treating the anxiety of like the pain is kind of what helps the pain the most, honestly. So and there's a lot of anxiety in many different of the conditions, the qualifying conditions. And unfortunately, you probably know this, but anxiety is not a qualifying condition itself. So nobody can go to the doctor and get a card just because they have anxiety. It's usually pain, PTSD, something else like that.
Understood. And do we know anything about the relationship of how cannabinoids work, particularly with reference to anxiety and the endocannabinoid system itself? I mean, in other words, do we have a scale for measuring anxiety and how that relates to the endocannabinoid system?
Yeah, so how it does work is so the cannabinoids will hit these receptors called the CB1 and CB2 receptors.
Mhm.
THC primarily hits the CB1 receptors. CBD will hit the CB2, but they also like will kind of compete with each other. And there's all these complex pathways. And I also want to mention it's not just the cannabinoids. There's also terpenes, which are the flavors or the smells, it's the oils.
The yummy
And I
stuff.
think the yummy stuff. Yeah. And I was just reading something about linalool, which is that lavender smell. And they use that a lot for anxiety and calming.
Mhm.
And back in the day, they used to use that to prevent seizures, which I thought was super interesting. So
Use it for
it's
what, Mindy? I didn't hear that because my earphones were obviously falling out of my head. But
they would use lavender to prevent seizures,
oh wow,
which is that's pretty extreme, like
yeah,
calming effects, really. So that was like
wow.
an older remedy, but yeah, it's just not just the cannabinoids; it's many different
Yeah.
chemicals in the plant.
Is lavender quick acting in that regard? I'm just curious.
I don't know anything. Honestly, I don't know
Yeah,
if there's ever been studies. I just thought it was interesting that that was an older remedy.
yeah.
Sometimes it's wise to look at the older remedies
Hmm.
and come up with things. But to me, it's kind of cool that
Like
they
the
even knew back
gooseberries,
then. The what?
like the gooseberries you were collecting. Isn't that what you
Oh,
mentioned?
no, elderberry. Elderberry.
Elderberry.
Yeah,
Sorry, back.
yeah, yeah, yeah.
Yeah, just
So
thinking
yeah.
of gooseberry wine and stuff.
Oh
Um,
yeah, I don't know what gooseberries are, to be honest with. I don't think we have any growing out here, but we do have elderberries, and it's a really good antiviral. So I do
Excellent.
collect those every year.
Antiviral. And do you consume that as a
Yeah.
tea or a rub or
So
inhalants or?
I'll collect them from the mountains above my house, and then I boil them with water, strain them, add them to raw Utah honey, and then strain it again. And then it's like
Oh,
you can take a teaspoonful every day to prevent the flu. It's for the flu, but I think
oh, right.
it's for any like viral infections. But I usually make it every September, and then it kind of gets us through flu season. And it also tastes good too. You can
I was going to ask
add it.
about that next if
Yeah,
it tasted good.
yeah,
Oh, very cool.
yeah,
So circling back to Wholesome and Co. and your involvement there, what does that look
yeah.
like for you on a daily basis as a PMP there?
Yeah, that's a great question. So, and so I'm not the only pharmacist there. There's a
Mhm.
wonderful pharmacist named Kylie, and she's kind of my partner. So me or Kylie are going to be there. Uh, when I'm not there, Kylie's there, and vice
Hmm.
versa. So Wholesome is open 7 days a week. We have a lot. I mean, I can't handle it all myself, of course, but we also have 5 other pharmacists that work from
Hmm.
home. So if you needed a remote consultation or a question, you could
Mhm.
actually call in and talk to those pharmacists. So there are 7 pharmacists at Wholesome
Oh,
that
wow.
are really doing all this work. But I
Are they
go in.
perhaps available via the chat on Wholesome Co?
I'm
Just
not
to,
chat, more like email. We
okay.
we use email, yeah.
Mhm, mhm.
Um, and so for every first patient that comes into the program, you need a consultation with a pharmacist. So if you come into and have the consultation with me, you'll come into my office and we'll sit down. I do a lot of explaining of the background. I talk about the rules. I talk a lot. I do a lot of teaching about why smoking is not allowed and why vaping is preferred. I do a lot of we talk about the different dosage forms. We talk about, I usually ask every single person that comes in for a list of their medications, and I'll write down ones that I think we could possibly remove in the future.
Hmm.
And I don't push anybody to do it, but I usually ask, is this a therapy goal of yours someday to come off these medications? Usually, more often than not, that's the reason they're there. A lot of people turn to cannabis when their traditional medications are not working, or they feel like they need to do something different.
How
So
frequently do you see medication failing in that regard over
um,
time? Is that something that's like a pattern that we should all be aware of?
so it just depends on the person. I probably see, to be honest with you, a lot of my patients fall into 2 categories. A lot of my patients I've noticed either are on no medications, and I think oftentimes those patients just don't have access to good health care. Our
Hmm.
healthcare system is a little bit broken right now. Not everybody's able to go to a doctor and get medications and be able to pay for them. But then I also see a lot of patients that are kind of on suboptimal medication regimens, meaning they're on 6 or 7 things and they know it's not working, but they don't know what to remove and what to stop. And it's cool because a lot of times I can see their list of medications and I can see which ones, if that's what they're desiring, I can see which ones would be safe to stop first and which ones. And almost all of my patients, before any stopping of medications, I always make sure that we're getting to a good cannabis dose. Like I make sure they have good sleeping at night before we try any of this. And there are many medications I would not recommend that people just stop suddenly. And I also recommend they talk to their doctors on certain ones too. But I do notice, sadly, a lot of my patients aren't really followed by a regular primary care physician. So a lot of them don't have medicines either.
Interesting.
Yeah.
Well, I can't say that I'm largely surprised by that out there, given the current situation we live in.
Yeah.
But that as it may, it's wonderful to hear what a day in the life of Mindy Madeo is, a PMP at WholesomeCo. So I wanted to maybe ask again, we talked briefly when I came in the other day about why cannabis strain names are misleading for patients and how that might affect or alter their treatment. Could you explain a little bit about that?
Yeah, so, and I do understand why people want to keep the strain names. You can usually look at a strain name and you can tell what the strain's genetics are. You can guess what the 2 seeds are they crossed. And that's nice, but the problem that I see is if you have a strain name, say you have Blue Dream in Colorado, it could be very, very different than the Blue Dream in New York, or very, very different. And not only that, it could be different from batch to batch, grower to grower. So I like the strain names. They kind of give me a clue what to expect, but I don't trust them. I think it's wise to look at the cannabinoid profile, the lab testing. That's something that I'm a little bit frustrated by the state of Utah because they still are not doing terpene testing. And I think that's
hugely important. Yes.
Yeah. And I can't imagine it's that hard to add terpene testing. I'm not sure what the holdup is, but right now I'm only able to see the different cannabinoids and but I would love for somebody somewhere to almost tackle this problem of the nomenclature. If we could have where we know that Blue Dream is always this percentage of THC and this percentage of CBG and CBN, and these 3 terpenes are the top 3. It'd be a hard thing to do, but I think then you'd be able to know exactly what you're getting. Until that day happens, the strain names are nice, but I just always look at the lab. You always look at the testing results to guess how a strain's going to behave.
So I guess it would be fair to say, Mindy, that one of your advice to prospective patients would be to look at what's on the label. If you're purchasing medicinal cannabis in Utah or exploring it, you really want to know what's in there and why it's in there and what it does for you. Is that right?
Yeah. Or get advice. That's why we have our agents. That's why you guys do reviews on different strains. It's nice because as long as you're trying the same batch from the same company, I think it's really wise to listen. Of course, Leafly, that whole platform is full of different reviews, and that it's probably more important to do that. But just make sure you realize that it has to be like the same grower, the same state, same place. Yeah.
Would you also then say that consistency is absolutely key when you're following up on these things? Because if you find medicinal benefit in a certain strain, a certain batch produced by certain growers, you probably want to stick with that.
And that's a problem in Utah too. We have a little bit of the shortage happening. Not only that, but from batch to batch, there are different, like even some of the tinctures, they have different cannabinoids each batch, and it's really hard.
So we're talking about problems with Utah product now. So please elaborate on, as a pharmacist, tell us what you see there and why it's failing.
Yeah, well, I just think I don't think it's failing. I think it's doing a good job for how new it is. I'm really impressed how many products we've got out in such a short amount of time.
Right.
And I'm very, very impressed how many people we have seen in this short amount of time. We've really served a large, way larger population than they thought.
Right. Demographically, are you seeing that cover a swathe of many different types of people?
Yeah.
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 That's cool to
I
know.
am there's different, yeah, I see everything. I see children, I've seen kids, I've seen the older population, I've seen yeah, just about, yeah, male, female. So what were we talking about before that? Oh yeah, the problems in Utah. I want to elaborate on this, the inventory. So also because we're so new, we're just seeing the products that are going to sell probably the easiest. So we don't have a lot of variety in our flower strains. So if you were to look at the THC, it's usually just higher THC percentage. I don't have any flower strains available as a pharmacist that has CBG or CBD. To me, I think in other markets you would have more mid-potency and more medicinal type strains, good for beginners. So, and then also it's just, yeah, if somebody gets used to taking like a capsule or a tincture, I can't always guarantee I'm going to have that in stock in next time they come in. So it's hard, but really with cannabis, and I try to give every patient this expectation that it's not the same as traditional medicine where you need to have like a 20 milligram pill and take this every single day. With all cannabis, there's not a lot of standardization. So I think the patients just know they need to figure out their dose, whatever product they purchase, and like just know that like if they were to get an edible 1 month, it may be a different experience the next batch they get. So they just have to be aware to always start real low, increase very slowly to their effect.
Yeah, I've heard that quite commonly said within the industry.
Yeah.
Wow.
It'll get better.
Yeah, I'm confident of that too. And I'm really, really encouraged to hear you say that as a medical professional within the green scene. That's wonderful. And you're also involved in research, and we're really keen to hear about your involvement with current research, Mindy.
Yeah, well, so I am going to school. I didn't mention that. So I graduated from the U as a pharmacist in 2002, but I returned to graduate school. I just started this fall. And so I'm going to the University of Maryland in Baltimore. They are a pharmacy school there that has a master's program in cannabis science and therapeutics. So I've been attending those classes, and I am just blown away by how much I'm learning. It's only been 5 weeks, but I'm really happy.
What's the most mind-blowing thing to date so far within that 5 weeks?
It's the people I've been meeting. So people in the field. I don't know if you're familiar with Aunt Zelda. She was on this documentary called Weed the People. That's not her real name, but anyway, I saw her on a documentary many years ago, and she's this fantastic lady that has been dosing cancer pediatric patients with cannabis for many years, and she was making it out of her kitchen in California way before you're able to purchase it anywhere else. And I kind of just like knew it. But anyway, I got to talk to her the other day, and like me and 5 other students, and on a Zoom call, and it was just really cool. We also are gonna meet the guy from Israel that even discovered THC. So I think it's cool. I forget his name, but he's like the godfather of cannabis research. But I think it's cool the people that I'm meeting and the network, like the virtual networking that I'm doing. And it's cool because we're able to like I can ask them questions. I had some CBD questions when I was looking for like a CBD supplier, and I knew somebody who was really good in the industry back east, and it's so cool that I can ask and get their advice as well.
Yeah, that's also very cool, bringing East and West together to address common problem.
Yeah, for sure.
Yeah, I really dig that. It's very heuristic. So why is ongoing pharmaceutical research of cannabis and its composites important for patients?
Yeah, so research is very, very tricky. So because of the nature of cannabis being a Schedule 1 medication, we have a hard time being able to do research. And not only that, when I mentioned those problems about standardization and consistency,
Mhm.
the problem with that, that also makes research very, very difficult, because you really need to have this very similar dose form for everybody. And the problem is people react so different. But I will tell you this: when you go to a PubMed is like a search engine for academic research studies. If I search cannabis, there is just thousands of papers on it, way more than any drug. That you could pull out any single medication, and you'd find that cannabis has been studied much more. So all these people that say that cannabis isn't researched, it's not that it's not being researched. It's definitely being researched.
Mhm.
The problem we have with it is it's really hard to fit cannabis into traditional study design. So we have
Which
to.
causes a problem within
It
current pharma industry
it
and
does.
medicine and insurance
It
and the
does.
natural medicine itself. Yes.
Yeah, and really a part of there's many problems, but part of the problem is that cannabis plant has 4 to 500 chemicals. So how can I do research on something that has 4 to 500 chemicals, and it's so different every
How many
single
chemicals
time?
are in a
So,
poppy plant?
I don't know that off the top of my head, but I
Right.
do know that they can pull out the opium, and that's like the one single chemical, and they can reproduce that each time.
Right.
We tried to pull out, we've tried to pull out cannabinoids separately. We tried to pull out THC, created a medication called Marinol,
Yeah.
and it didn't work.
Artificial THC, essentially, right?
Yeah, but
Mm.
it was horrible side effects. It wasn't really effective. I rarely dispensed Marinol. It was a Schedule 3, so you were able to get into
Ah,
a pharmacy.
all right.
There is also a CBD isolate called Epidiolex that I think is doing okay, but I still think we just need the whole entire plant, because it's working in ways we can't even comprehend.
All right.
And we know it works. I mean, I've seen it work. I don't necessarily need research studies to tell me I've seen it. So.
Right. Right. What area particularly are you excited to continue learning in regarding cannabis?
I have a couple. So of course, my big passion is opioid reduction
Mm.
dosing. Like I touched on that. I want to get everybody off of their real heavy pain medications. Another area that I've just started researching, I did a project for school, and I'm actually really interested in, is autism.
Mm-hmm.
And an interesting thing about autism is they've done studies, and they can tell that people on the autism spectrum disorder do have lower amounts of anandamide. So, do you know what anandamide is?
Mm-mm. No,
It's
please explain.
so anandamide is the chemical that's released when you have a runner's high.
Mm.
It actually is kind of how we discovered THC. So anandamide is called an endocannabinoid. So it's something our body, it's like a natural THC molecule. So our body naturally makes it. So that runner's high feeling, that's what THC is kind of replicating. So and so they refer to THC and CBD, CBG as phytocannabinoids.
Mhm.
Meaning they're from the plant, but they're cannabinoids we're putting into our body. So, but anyway,
That would mean full spectrum. Is that right? When I hear the word phyto, for some reason,
I think phyto refers to plants, I believe.
okay, okay.
So, but yeah, so they're finding that these kids on the autism spectrum disorder have very low levels of this anandamide naturally in their system. So it makes you think that THC, if we could add this back into their system, there could be some sort of benefit there.
Mhm.
And there's no data showing that it will treat the core symptoms of autism. But with autism, you have a lot of comorbidities like anxiety and pain, digestive issues. So the research is, I mean, it's still going on, and they actually just finished this amazing study that was like really a large amount of people, and it was like randomized, placebo, double-blind, controlled. It was this great study setup, They wrapped it up in 2018, and I'm excited to see the results of that. But even if I think with these autistic kids, even if it doesn't cure anything, it's worth a try. Like if it can help their symptoms, I think it's very beneficial. So, and from what I can tell, about half of the kids respond really well and then half don't. So we're still trying to figure out why. So
Right.
I just think it's really interesting. I'm a mom myself, so I just kind of put myself in those moms' shoes. And I think if I could give my child cannabis, it would replace a lot of really heavy duty medications that aren't really good for them.
Yeah. And what a relief. I mean, in a number of different ways. I mean, everything from
Yeah.
financial to emotional, truly.
Yeah, for sure.
It's kind of what I was thinking. Well, Mindy Madeo, we are so grateful for having spent time with you today. I feel much better educated about how to approach cannabis. Do you have any final words or reflections? Absolutely. For perhaps people wanting to explore this as an alternative.
All I want to say is I'm really happy to help people, to consult with them. And so if you come down to Wholesome, you can make an appointment with me anytime. Even if you don't have a card, I'm going to say, like, if you're just interested in the program, I could check you in as a guest and have a consultation with you and just give you the pros and cons.
Sure.
And I want to do a lot of education. I want to legitimize the industry, if you will. And I want to make people feel comfortable that have been using cannabis for years. I don't want the shame and the guilt that is so wrapped up into it.
Right. On that question, it brings to mind, I don't mean to be cheeky by any means, but I'm wondering, what's your view on recreational cannabis?
Oh, I'm so glad you asked that question, because I do have some very strong feelings on it. So I actually dislike how we categorize cannabis use into recreation versus medical, because I've talked to enough recreation users, and I know that the reason, if you ask them enough questions, the reason they're really using it is they're self-medicating. So these recreational users are using it in place of sleeping meds, anxiety meds. I think it's a spectrum, and I think we have to be careful categorizing them in these two categories, because then it makes one bad and one good. I think everybody should have access to it, to be honest with you. And yeah, like I said, most recreational users are using it as some sort of self-medication. And I talk a lot to recreational users, and I've got I think there's a lot of education that needs to go into people that we would consider recreational users. There's a number of people that get into these really high tolerance states where they're consuming such large amounts of cannabis, and it's not dangerous by any means, but it starts to become less effective. So I do a lot of education on teaching people how to take little small breaks. We call them drug holidays, where you just take a week off, kind of reset your tolerance, and slowly increase. So a lot of times when those people come in, we still talk a lot about, there's a lot of education still happening. And I also warn people to avoid, really almost everyone that comes in, I give them 2 words of advice. I say, don't ever use cannabis to check out of life or to avoid things. And try not to chase that super high every day. It's something that is fine occasionally, but if you're always trying to just get out of your head every single day, you'll have a problem with it. So
Excellent points all. And of course, I can't express my gratitude for the time we spent today. It's really kind of very cool.
Thank you.
Yeah, and if we may, we'd like to follow up in the future as more science becomes available and as you discover new things, if that's all right.
Yes, yeah, for sure.
Awesome.
Yeah, it'll be interesting after I go to school for a couple of years. I mean, I just started school, so maybe after I've been in school for a year, I'll have a lot different ideas. Who knows?
Well, how would you compare your current pharmacy self to your former pharmacy self? I mean, pharmacist, excuse me.
I was always I wasn't a traditional farm. I was a very, like I said, I was a very natural pharmacist. Like I really would try to get people off their medications
Right.
at all times. And I really, I don't know. I'm pretty similar. I think it's more my personality where I really follow the rules and I'm a little bit OCD. All pharmacists are OCD to some point. That's why we're pharmacists. It makes us good at our job. But I'm also laid back and I can see grays and not everything's black and white with me. So I think that's key for cannabis pharmacists, that you're not trying to fill this box, and it's a little bit different. You have to have an open mind a little bit because things are changing so much.
Does that suggest that you are yourself a cannabis user, and if so, a preferred method?
So yes, not in a not on the regular, I would say. And I actually think the most natural, best way to consume cannabis is via the flower. Because you've got the whole plant. To me, remember when I talked about all those chemicals that we don't even know that are in there? I like to experience the whole thing. But also edibles are good too. But yeah, I definitely, and I do have a medical card in the state of Utah, so I know the process really well.
Excellent. All right.
Yeah.
Well, let's leave it there. And again, we'll look forward to what you have to say in our next installment sometime in the future.
Okay.
Thank you very much, Mindy Madeo. Have a lovely afternoon again. Thanks.
You too.